Supplies keep on working their way in. Wow. There we go. Yeah. What's the meeting ID? Oh, is it right there? You can just click in participants. I'll go to the top of the Zoom bar. Somewhere it should say it somewhere on there.
This thing is acting weird.
I know. I thought it was too.
Fudge. It's not showing my shared screen for some reason. It's letting me share the screen. Here. Yes. 949 6633 7291.
Do you call the meeting to order?
I would love to call the meeting to order. Frank wrote a lovely note explaining to us what we're all doing and able to do in the session. And this is a continuation of the prior session. So I'm reconvening us as opposed to convening us and after the recess. And we are going to go forward and do a couple of topics. Before we do that, we need to verify that we are here. So, Jamie, would you mind taking a roll call?
Yes, Myra Alvarez,
Here.
Monty Davis, Monica Fitzgerald,
Here.
George Halverson,
Here.
Shana Hazen, Molly Munger,
Here.
Jackie Majors,
Here.
Chris Perry.
Present.
All right. Well, go for public comment. Any member of the public care to speak up to 3 minutes on any matter concerning the state commission, with the exception of items appearing elsewhere on this agenda or items relating to pending judicial, administrative, litigation, or personnel matters? No action by the state may be taken on those issues, and we are inviting the public to comment now. And Camille, the process for doing that is?
So we'll look right now, George, and if, again, as we've done in the past with how we conduct these meetings, same way today. First of all, I'll just take a couple of minutes. If anyone online is having any technical difficulties, please send an email to info@ccfc.ca.gov. We have staff on standby to help you with those technical difficulties. We're asking everybody to eliminate their commissioners, as you have been so good about. Just put yourselves on mute while presentations are happening or other commissioners are speaking. Everyone can use their raise hand function that is part of Zoom. Or if you all physically raise your hands, we can make sure that you are all called upon and have an opportunity. For the general public, just like any other in-person commission meeting, except if they will use that raise hand function. And we here in the staff will be monitoring the list and make sure that you are called upon. We will unmute you and you'll have a 3-minute time limit to say what it is you have to say. So right now, George, going back to that public comment, do we have anyone? We do not have anyone who has raised their hand to speak. So I think we are good to continue our meeting and go to item 6 from our previous agenda.
Thank you very much. Would you please take us to item 6
Sure.
and describe the thought process? This is going to be a chance for us to do some thinking about some future direction in a couple of key areas, and particularly thinking about what do the children need in this time frame, and what do the people who are delivering care to the kids, what can we do to support what they are about? So Camille, what's on the agenda? Take it away.
All right. Thank you so much. Good afternoon, commissioners. It's getting to be a Friday habit, all of us getting together and having an emergency meeting. So pleased to see all of you. Hope you are all healthy and safe. So, so just to get us started, I just want to lay out a little bit of this item and then really turn it over to all of you to have a conversation and to hear your thoughts, and hopefully from that staff will get some direction about how to proceed going forward. So, we heard at the commission meeting in April that you all were saying that you really wanted to have an opportunity to discuss longer term COVID-19 recovery opportunities that the commission should consider. That was important for us to not only think about supplies and what we do immediately, but also to think about what's long term, that we could think about and possibly down the road invest in. So, and certainly budget is a consideration for that decision. And as we told you last Friday, we are scheduling a budget retreat, hopefully for the middle of June, where commissioners will have an opportunity to review funding that has been already obligated, look at possibilities of things that the staff has thought about would come up that are aligned to the strategic plan, and also for for commissioners to have an opportunity to see where funding might be available to do some other things. We sent out a request, a first request for some dates in June, and unfortunately, those dates did not work for a lot of people. So we're going to be sending out a second round, but I will tell you that round would include June 15th, 17th, or 22nd. So look for that email, hopefully today, if not for sure on Tuesday. But those are the 3 dates that we are looking at for possible budget retreat in June. We have asked, as we told you last week, the Glenn Price Group to facilitate the retreat, and they will be contacting each of you for a short interview before the meeting so we can do some better planning and make sure that we are hitting the goals and meeting the mark for information you'd like to see presented. Having said that, the goal for today's discussion, as we said, is to really talk about the opportunities to address longer-term COVID-19 recovery investments. And hopefully for all of us, for staff to get some direction from all of you about what you would like to see us to research, to put together proposals on, or get more information on and bring back to you. Looking ahead, we want to ensure as part of your discussion that our long-term projects align with other statewide efforts. So certainly at the top of that list is the governor's master plan for early learning. The final plan, as we've told you before, is due in October of this year. But we're lucky enough to have Chris Perry, who is heading up that effort with us. And so I'm sure as we move along, Chris will be able to update, inform, and help us understand what is occurring in those discussions now, and hopefully give us, I don't know how your crystal ball's working, Chris, but to give us some insight about where in the future, how things would line up. As we proceed today, we've brought forth a couple of ideas to get the conversation started. And so we're going to present, I'd like to present those ideas. And again, this is information only. This is a way to start the conversation. Things that we believe align with the work that's going on with the master plan. And also for all of you, in addition to those couple of items, having an opportunity to talk about things that you would like to see us think about in the future.
Camille, before you go forward, and this is a great list. For context, in a little bit of history, years ago, healthcare used to be focused very much on the caregiver. So the thinking in healthcare was about the caregiver, strategizing, budgeting. Financial world was very much caregiver-oriented kind of approach. And that produced some good care in a lot of settings, but it was not as good or useful as when we transitioned from thinking about the caregiver to thinking about the patient. And so we've gone through a whole culture change, process change, and we started measuring patient outcomes, patient satisfaction, patient involvement, and healthcare, it's much easier to think in positive ways about certain aspects of healthcare if you go into that thinking with the patient as your target goal and focus, as opposed to the care sites. And some places still, care sites still focus on care sites. But the places that get it right, and the overall world and the policy world for healthcare is now focused on the patient. So all the Medicaid programs around the country now have 60 to 80 patient measurements that didn't exist. They used to measure the Medicaid programs totally as budgets. That was completely and totally a budget program. Now they keep track of how well they're doing in all of those. They're reducing second asthma attacks, for example, is now a measurement in that space that wouldn't have been there if they wouldn't have focused on the patient. The reason I mention that is in education and childcare, we have a pretty major focus on caregivers and not and programs and budgets, and not as big a focus on kids. And so rather than we don't focus on kids and say, okay, what do we really, really, really need for kids? And that it seems like we do, and it might sound like I'm being confused in that point, but we really don't. We really don't say, what can we do to make life better in significant ways for kids? And what does that mean? And what do kids need if we're going to go forward and do this right? And how do we make sure that we get the right start for the kids? And when we look at an issue like social determinants of health, which is huge, we know that the social determinants of health impact on people's life and their economics is massive. And we know that the Hispanic families and African-American families have very, very, very low net worth in those families. And we know that we're not going to change that painfully low net worth if all the kids who come out of high school can't read. So those differences aren't going to happen until we go upstream in the process and help the kids in that little window when we can help them. So if we think about what I'm suggesting in this is that early literacy, when you look at early literacy, the early literacy scores, so that we don't keep track of. I mean, healthcare, we start keeping track of diabetic readmissions. We don't have any literacy scores really for kids. We don't have pre-literacy scores for kids. And when you look at the kids who don't graduate, we know by age 3 which path they're on. And those kids are 4 times more likely to be diabetic. They're half as likely. Kaiser Permanente studied the difference on health of the kids who graduate from high school versus the ones who drop out. And even in that setting, they are twice as likely to have bad health if they dropped out, even in that kind of a setting. So we know that they're 6 times more likely to go to jail if they are not learning ready at age 3. And those are real numbers. That's not theory, that's real numbers. So what I'm suggesting is let's look at this from the perspective of kids. Let's look at this and say, what impact will this have on the actual children of California, and think it through to the level where we actually get it down to the kid. So it's not just about how many babysitters do we have in an area, but what will those babysitters do that is really going to help those kids and make the kid the focus. Now that actually, once you start doing it, it's actually kind of easy to do, but initially it seems like a barrier. But let's, as we're going through this process and we're going through some other meetings, let's think about what if we did everything and made kids our absolute focus, and then built everything from that, and just the brain development of it happens in the first 100 days of life. Is stunningly important when you look at kids, and it's only moderately important if you look at programs. But for each kid, it's a hugely different thing. So we need to add that. So I'm just putting that out as a context point, and we'll come back to it in our future retreats. But also as we look at these issues, let's think about these issues in that context as well. So that was a bit of a sermonette, but I watched healthcare change when we started focusing on the patient, and my golly, it was so much more fun and it was so much easier, and care was so much better when we made that change. So
So George, I
that's
saw
up
two
there.
people raise their hand. I saw Jackie and Myra raise their hand. And
Good.
Monica, 1, 2, 3.
Yay,
So-
good.
So I don't, do you want to go to Jackie first?
Sure. George, I really appreciate all your comments. I appreciate the focus on kids because I think as commissioners of this body, we definitely need to be thinking about kids. What I do want to stress, though, as we're talking about this, is that we be really open-minded to how kids are best impacted by the resources that we have. I also want to say that as we're thinking about that, I think the childcare provider population is a very important component of that. I also want to just put context around the language of babysitters in that, our childcare providers are doing some incredibly amazing things, not only to support our young children and to deliver a lot of these resources, education, and support that you're talking about that benefits these families. And without them, having the impact on all of California's children is impossible.
I
And
completely agree with you.
so let me just finish by saying,
Okay.
I want to have several perspectives as we're looking at this. And I want to say this affirmatively and positively. I want to look at it from the perspective of the child. And I 100% agree with you.
Yeah,
but I
right.
don't want to be so narrowly focused on how that happens and the goals of how that happens, because there are so many ways that I think we can support our young children. And I don't want to start that by eliminating avenues that we can support them through, and how to get the best bang out of our buck. We don't have a flowing river of funds. And so how we think about how we can best support the masses, I think we have to think about the conduits of that in a very sort of respectful and critical way in how we deliver that.
I totally 100% agree. We need to help all those caregivers. We need to give them all the support. We need them to do the job they're doing. We need them on the spot delivering great care to those kids, and we really need them. We need to support that and not divert anything away from them, but enhance their lives, make their lives better, and do that. And we need to look through them to the kids and not just have them being with the kids being the right thing, but when they're with the kids, what are they doing that's going to make life great for the kids? Because when you measure it at the kid level, then you think about it a little differently than if you just measure it at, let's have caregivers be with kids. That's good. Let's have caregivers with kids and do something great. That's better. That's where I am. Because I love all of those folks. We need to support that with as many resources as we can. But we also, it's like we did on asthma care, we also need to have the caregivers delivering great asthma care.
Okay, Myra, you had your hand up.
Thanks, Camille. Thanks, George, for those comments. And hearing what you were talking about with regard to how we're measuring our investment in children, and if we're reducing second asthma attacks, or if, kindergarten readiness levels, or if they're more likely to graduate high school. I just want to keep reminding us that, consistent with our strategic plan, child health is a huge priority, or should be a huge priority of our work. And that master plan of early learning, it's master plan of early learning and care. And when I think of the word care, it's not limited to child care, but it's also inclusive of healthcare, and really consider the responsibility of our healthcare sector, especially where we can work to hold our partners accountable. So our health plans, our Medicaid managed care plans that are taking care of our kids, are they conducting the necessary services under EPSDT, early prevention, screening, diagnosis, and treatment, that we know our kids deserve, right? Developmental screenings, and making sure they're meeting those health milestones that can hopefully identify earlier on areas that we need to invest in child health and well-being, and thinking about where the commission can serve as a good partner with our HHS agency partners, and thinking that through. Like, I would love to explore that
Yes.
as a commission.
Yep.
Again, really, I think there's so much opportunity in our Medicaid program long term. I'm not saying immediate changes, longer term, but that's exactly what this master plan is. This master plan is a commitment on behalf of California's long-term strategy for early childhood development, and we can't leave out the health sector in that discussion.
I totally again agree. The Medicaid program, we have to use that tool in very effective way. I'm actually on the national program that sets quality standards for Medicare plans around the country. NCQA, most of the Medicaid plans use our standards. I love improving the care in the Medicaid setting. And we need California to have the best Medicaid program in the country. And we need to have best care there. And that best care needs to include the brain science in helping the kids as part of the agenda, and not have it be a carve out, which is silly because a brain is only one brain. But no, I have done a lot of work on Medicaid. I worked with the National Medicaid Alliance, spoken at national Medicaid conferences. I love Medicaid and totally support that. We need to make Medicaid very, very strong in California. But that shouldn't be an or, it should be an and. We need to have those people coaching every single mother, and 90% of them are not coaching the mothers in that space right now, but they all could.
Monica, nice to see you.
I know we all know this, but I always think it bears repeating when we look at this sort of data and the health outcomes, and the pandemic certainly even brings more of a spotlight on this, but I think so. I just think it bears repeating that when we look at this sort of data, we also have to look at it in light of institutionalized and systemic racism that is impacting our caregivers, our families. And I think that that's something that I know it's part of the strategic plan, but you know, some of the data, I know it's around early literacy, but the school to prison pipeline is so much more complicated than that. And I think I want us to keep in mind as we look at this is to really sort of address that as well, right? In terms of how we navigate this, and how we train our partners are trained to be in settings and use asset-based language, basic things like that. I just think it bears repeating, and it's just been on my mind a lot in my world teaching, that I wanted to put it on the record.
And I totally agree with that as well. And a quick comment on that. We know I work on that all the time on the racism stuff. In that particular, and the thing that we know is African-American males who dropped out of high school, 60% are in jail today in their 30s. African-American males who graduated from high school, 10% are in jail. Now that's way more, that's 5 times more than the white population in jail, the graduates, but it is 60 times more if they didn't graduate. So the prison pipeline is fed from that nursery, and the kids who aren't literate go to jail. They go to jail 80% of them will end up in jail if they're not literate. So when I talk about the pipeline, I talk about literacy as being the single most powerful thing we can do in this country to change that pipeline. And we know that to be true because only 10% of the grads go to jail and 60% of the dropouts go to jail. So that literacy pipeline starts when those first couple of years, and those first books in the home are the beginning of that channel. And the racism is horrible. But it gets 10% of the people in jail when it's 1% of the white population, but 60 is worse than 10. That's why I totally agree with you. And I hate that pipeline. I usually open with that when I'm in other countries. I talk about how many people we put in jail. And then I also talk about the fact that it's the dropouts that we imprison. By the way, Canada puts the dropouts in jail at an 8-to-1 ratio as well. They have hardly anybody in jail in Canada, but they put their dropouts in jail as well because they can't read. And so what do you do when you can't read? I totally agree with you as well.
So I'm going to bring us back to talking about more. Oh, Chris, sorry, didn't see you. Did you have your hand up, Chris?
I did. I was actually kind of hoping you would do that, Camille. I'm still not clear on what the agenda item is,
Right.
and what we're trying to figure out today. I know these are really important topics, but we only have a few, like 90 minutes or something. So can you bring us back to the agenda? Thanks.
Sure. I'm coming right back there where we started.
Right, although Chris, I would argue that it is context for the agenda and because we need to focus on kids. And that's what I was trying to say was all this stuff that's focused on kids. But Camille, take us back to this part of it.
Sure.
Thank you.
So how I want to start out or come back to is to just talk for a couple of minutes about how our current investments are currently already addressing, I would say, long-term recovery, current and long-term recovery, and then talk, as I said, we've got a couple of ideas to share with you about possible ways we can work in the future, and then certainly want to hear from all of you as well. One of the ways that we are doing this and have made an ongoing investment is our investment in Impact, both currently and Impact 2020. As it turns out, the priorities of our significant funding that we put there really align with the needs that our state now faces. First, and you all have been talking about it, we know families are under tremendous stress and need helpful, practical tools to inform their daily life, balancing work and family, and doing this often now all from home. So if you haven't, I would suggest if you haven't gone to our parent website lately, you should take a look, because we've really done, I think, a good job of really customizing it with response to COVID-19. It is full of helpful tools for families, and we're constantly expanding this message with activities that folks can do at home with their children, providing families with information and a trusted ecosystem with helpful tools to support them. You'll see we're sending some updates out to all of you where we have Facebook Live that we're going to be a story time with the first partner, with Mario Lopez, with others that we are launching as a way for parents to break up their day a little bit and have someone read a story to their child. The Surgeon General, I believe yesterday, recorded another couple of radio spots for us on the power of that social emotional bond and how to do that now. Commissioner Alvarez, we've had her busy on the radio and in other ways, doing several interviews, most of them I think in Spanish. Appreciate that. And so we're working hard to really provide that now with folks, and with all the messaging that we're doing. Certainly we do talk about early brain development, talk, read, sing, and to be very friendly, user-friendly ways for families to get involved. And while we're still learning, obviously, about the full impact of how COVID-19 is and will impact our early learning and care environment and sector, national estimates right now say that between 20 and 60% of those early learning and care settings will not reopen. This has had and will have a devastating impact on the lives of families, particularly if they struggle to return to work, as well as for the professionals who are currently employed in this field. I'm sure as all of you go forward in your everyday life, as we are here as staff, trying to figure out how do we have not only that balance, how do we do this from home, but now how do we do it maybe part-time back in the office and not. We know that it is causing families to really have to think through how we do that going forward. So as families start to return to their early learning and care programs, they are telling us that they really would prefer smaller, more intimate settings. Totally makes sense. And so the great thing is impact dollars really, and we have said, invest our significant funds in the improvement of those kinds and the support for early learning and care settings, particularly with family childcare and alternative or family friend and neighbor and alternative settings, really trying to focus support there where we know our families have said that's a kind of care that they feel comfortable with as they go back to work in their offices. So finally, we heard during the May Revise briefings last week, as you all have said, we're facing historic budget shortfalls, and the potential for more pain to come, unfortunately, is real. So through Impact, we required local partners to work closely together and develop a single unified plan and a quality improvement plan with one set of goals and targets. And what we've heard as they've done this work over the years, now as this crisis comes forward, they have a network already in place to go to. So they have relationships with their partners. They are working together in ways that might not have happened 3 or 4 years ago. So we're excited and proud of that. As we move forward, the plans that they're working on now for Impact 2020 identified countywide targets with different settings, as we said, family childcare, family friend and neighbor, alternative settings, to be involved in this work, as well as outline how partners are working together to achieve them. So just to, say it one more time, it's going to be essential that more than ever, local partners work closely together, maximizing funding and providing streamlined supports. At both the state and local level, we will all be working with less, we know that, so working together is more important than ever. The other thing that we've been working on with the current round of Impact, as we will in the future and with everything we're doing, is how do we provide flexibility at the local level so that really folks can address their unique community needs. So our Impact for RFA, our request for application for Impact 2020, sets a framework for this and can be part of, we believe, creating efficiencies, streamlining quality improvement supports, and more effectively engaging child care providers and families to provide support for young children as everyone will need as we recover from this crisis and beyond. To George's point, I think you always do think of that child and first and what the outcome is. And as you've all said, there are many ways to get at that. And so as we talk about that today, figuring out what those supports are in a variety of ways that ultimately help that child and that family thrive. So the first idea that we're going to throw out there and for you to just kind of get the thinking started. Again, our goal for today, while it doesn't seem that way at this moment, is to listen to all of you and hear your thoughts about ideas, proposals, possibilities that you would like the staff to go back and find out more information on, draw up a proposal, understanding that the June budget retreat will obviously shed light on ultimately what First 5 California can do. But with that, the first idea we would like to share with you is something called shared services. The early learning and care sector has always been and is extremely financially fragile. Even before the pandemic hit, we know that high labor costs due to low ratio requirements, limited funding since families cannot afford to pay more, and low state reimbursement rates mean most early learning and care programs operate on razor thin margins and they all struggle to be financially viable. We all know, and we've always said, for those of us who've worked in the field for a long time, knowing that, people don't get into this field because they want to make money. They get into it because they want to care and give children the very best and support their families. So further, most early learning and care programs are small, which means that the child care provider often wears a variety of hats, including the business operation officer, the educational leader, the manager of staff, and one of the family's key supporters. We have an opportunity right now, we think, as we strategically rebuild from this pandemic, to build a stronger, more resilient, and higher quality system that supports those providers and maybe hopefully helps ease the burden on the administrative side. A model that has been proven effective in other states and here in California in some counties is a shared services model. It is a model where early learning and care programs voluntarily band together to increase program revenues through different actions like centralizing enrollment, managing payments from families and third-party funders, payroll, grant reporting, and key aspects of supervision. Shared and efficient staff, recruitment, onboarding, professional development, and support for educational leadership, substitute services for teachers, in addition to accessing benefits, insurance, bulk purchasing, janitorial services, and other services at greater scale, so a lower per unit cost is available. These shared services alliances are community-based and can be for centers, for family child care, homes, or both. They reflect, as we've said, the unique needs of the community, and no two alliances look alike. Importantly, shared services alliances can dramatically improve program quality, which is what we said in the end. Improved program quality leads to better things for kids. This can be done by bringing in more revenue so more qualified staff can be attracted and maintained. Extra staff, like a curriculum specialist, can provide targeted support across multiple centers or homes. Learning environments can be improved, or staff providers can receive benefits. There are many examples of shared services alliances around the nation, as I said, including here in California. So as we think about this today, a way we, First Five California, could support this strategy is to provide some competitive startup grants to new alliances. We can pull from successful similar initiatives from around the country or the state itself and incentivize community-based groups to start these new alliances. As you saw in the item, something that we've thought about is possibly taking on maybe 10 to 15 of these new startup grants to around the state to start to get the alliances built throughout. So with me today on the phone is Erin Doobie of our staff and also Abby Thorman, who is a consultant with WestEd, who's not only working with us, but I know is working with Chris and their staff and with CDE. She might as well move to California. She's working with all of us to answer questions if you have those. But I really kind of just want to get through the other idea we have and then open it up for your discussion. So I'm going to plow through and keep talking, and it won't take long, but talk for a moment about a second possible suggestion, something for you to think about, which is around workforce development. Because we know more than anything that is going to influence a child is that relationship with a caring adult, certainly with their families. But after that, probably if they're in a child care setting, the person they're spending a great deal of time with is their child care provider. So how do we help those in the field really and support them that they have all the tools they need to do that work, in the very best way they can. So research on, as I just said, on the quality early learning program shows that the most important factor in children's short and long-term outcomes and positive outcomes is the quality of the interactions between the adult and the child. So again, as the state recovers from COVID-19 and rebuilds and supports our early learning and care sector, there's no more important investment we can make than the building of new and supporting existing early learning professionals. We know and we see every day that in a state as large and diverse as California, that traditional face-to-face training models cannot be taken to scale. While there's certainly pockets of excellence around the state in many places around the state, the early childhood workforce simply does not have access to the amount of high quality content to move forward. We have seen and talked to many early learning professionals and their interest in online learning. And it has especially, we've seen a spike since the pandemic started. SECO, which is an online professional development website that is funded through CDE and federal funds, has had thousands of new users in the last 6 weeks. So people are really now really looking about how they can change practice, what they can do to improve. And so building on these efforts, we really see there to be a need to invest in a much stronger and more engaging approach. Just like with K-12 education and higher ed and everywhere else, online and blended models, so part online, part face-to-face coaching or communities of practice, have proven in the past to be a highly effective way when they reflect obviously best practices in adult learning and engaging online approaches. We've been developing this idea in our work with Impact for a stronger blended professional development system over the last few years. So we've already been working on it. Through the initial Impact grant, First 5 California and its partners have developed a coaching certification system to strengthen coaching practice, trained hundreds of community of practice facilitators, and are excited about this new professional development platform that will be built through, again, the use of federal funds, the use of funds through California Department of Ed. So over the next 2 years, over 300 hours of content will be developed to meet the needs of the early learning and care workforce. The content will be in English and Spanish. Most will be available for college credit, and it will systematically build the skills of the workforce. First Five California, if the commission decided, could participate in the building of this content. We could work to expand its access more quickly. This will help not only the existing workforce, but bring new professionals and onboard them consistently and efficiently. First Five California could fund the development of specific content on topics that could help rebuild the workforce, such as new mental health needs that we're seeing from both children and caregivers. Could we develop content that has arisen obviously through this crisis that would help childcare providers address those within their program? We could look at related fields such as home visiting or other investments, taking into account what Myra just said about health. This can go beyond. So these are two possible ideas that we're putting out there to start the conversation. So now, finally, we would like to hear your thinking on what you think about those ideas. Abby and Aaron are both on this call with us, who are there to also answer questions. But more importantly, not only what you think of those ideas, but what other types of ideas as a group would you like to think about? And hopefully at the end of this conversation, staff will have some direction about what it is you'd like us to move forward with to explore. So that's it. That's my presentation. So I'd like to ask if you have questions right now about any of what I've said, or you're just interested in moving on to this part of the conversation.
Really well said. Can you restore the screen so that we can see each other? Or are we?
Let's go there.
He wants this there. Is that better?
Yeah, perfect.
Okay.
Great ideas, well said. What do you think, folks?
Again, Abby's there as well to answer questions. I see there. Hi, Abby. Myra?
I just have first, can I just start with a basic question? Is this something that is a new investment in response to what's happening, or is this part of a longer term investment in the next fiscal year? Or is it like a rapid response of our existing revenue for this year? I'm trying to understand which bucket we're putting this in, the long-term planning or immediate response to COVID?
I think I would put it, Myra, more in long-term planning. Like it's a way to rebuild back. These are investments that would help rebuild and think about how we align with the thinking of the work that's going on with the master plan and how this would line up. I don't know, Chris, if you want to add anything to that about the master plan side?
Sure. Yeah. I mean, I actually thought, Camille, your answer might be both and, because, you know, everything is at this point, right? We are starting in a new place with all of our work. The master plan started last year, pre-COVID. It's underway during COVID. It has to articulate a path forward post-COVID. So everything that Camille just described on the PD, professional development side, or the shared services side, is, in a sense, they've like bubbled up to the top in a way because of COVID as maybe a couple of the best things to move forward on first because of COVID. But it'd be more, they're durable. Like they would both do a lot to buttress the early childhood system in ways that we've needed, but we're probably going to take a lot longer to get to. So through the master planning for early learning and care process, there's a strong desire to name short, mid, and long-term goals, and to have First Five California be a partner in any of them, it would be really, really helpful. Not just financially, but for all of these, all the in-kind work that goes on media, all of the thought partnership that happens across multiple issues, and in some cases, financial help. But I think it's the bringing First Five closer into what the administration's working on for the future of early learning. And these two areas are kind of more shovel ready. Like if we're really thinking about early investments, recovery investments, stimulus to the system, these would be top of the list.
That's really helpful context. Thank you. So related to that, something that I would benefit from is during our last week's meeting, you had mentioned that the commission has given far more flexibility with the impact dollars, and what that flexibility means and how it relates to these new investments. Is there a duplication of efforts with the flexibility of those dollars and trying to figure out, long-term workforce needs or shared services alliances for sure? I'm trying to think through what of those dollars are going towards building these relationships, these shared service alliances that I think are critical, so that we have a better understanding of what we're supplementing, not necessarily supplanting.
I don't know if I'm going to look at Abby or Aaron to see if they might want to speak to. They might be more articulate than I would be, Myra, on that response.
Well, I just wanted to, and Abby may have some more comments about the shared services model, but just in terms of impact, we have provided flexibility to the counties or just made some sort of creative suggestions of ways that they could use the funds that would really help with COVID reaction and recovery. But I don't believe that any of them are using the funds currently to do either of these activities because they're both more at a state level. I do think that there are some counties that are, in particular with the Shared Services Alliance model, that they are actually implementing that, but it wouldn't be with impact dollars. Impact money is generally going more specifically to improve quality. And I think with the Shared Services Alliance model, you do see improved quality, but it's more through creating administrative efficiencies and economies of scale for smaller providers. So it's related to impact, but a little bit different, if that helps.
Abby?
I would say that they're very much supplementary and complementary to each other. It's not supplanting, but would really be additive. Aaron spoke well about the shared services model. I would say on the workforce development front, we've seen in the last 60 days an explosion of providers taking courses on SECO, which some of you may be familiar with, that offers online learning experiences for early childhood professionals. It was built on a shoestring, so they're largely talking PowerPoints, but we've seen 10,000 new professionals on that system each month, with huge spike in demand because people are really eager for high quality online learning experiences. This new platform that's going to be developed is really going to bring the best of adult and online learning together and really provide gamified elements and things like that that really, we know, increase the stickiness of people learning things and also increase the joy of learning, since most online learning is not that exciting, and that it really provides a new core that helps to democratize access to the early childhood workforce of really high quality content and better use some of our investments around coaching and community of practice facilitators and other efforts that First Five has historically invested in by providing greater access to resources, as well as access to college credit over time.
So if I'm understanding the resources or the resource investment, it's really to supplement statewide efforts. So it's not necessarily going to counties or going to community entities, but to a contractor to do this work in conjunction with the state. Is that right?
In the case of the shared services example, and there's a lot of different models of doing this across the country, but the one that's worked best has been putting out an RFP for community-based entities to really take the lead on the work. In some cases, that's an R&R. In some cases, that's the equivalent of a Fetchin. In some cases, that's a community organization like a Cadango or somebody like that who has a long history of really leading innovative work in local communities. And that seed startup money is for them to start an alliance. And most of those, if they're managed well, can be largely self-sufficient within 3 to 5 years. They just need some startup dollars to get them going. So what it's shown in many other communities to do is to really provide a more durable way to both decrease turnover, to really support smaller community-based programs, be they centers or family child care homes, so they're more efficient, but that and also in ways that improves quality. But because
how big are they in 3 to 5 years?
I'm sorry?
How big are they in 3 to 5 years when they do that model?
It really depends on the model. They vary pretty widely.
Yeah.
Okay, last question, I think. So I fully support the shared services idea, and I mean, First Fives are leading the way with that, right? When it comes to Help Me Grow and other programs like Healthy Steps, I mean, you name it. Is that what this is? So folks or community orgs that are already implementing these models can receive a jolt of investment in order to expand it, and we would then evaluate that. I ask that because we have so much evidence already that demonstrates the effectiveness of this model. Is seed funding what we need to do, or is there a broader conversation in the master plan to really think through how is California making that long-term investment to support this model statewide and not through 10 to 15 entities? Because to your point, Abby, this is one-time money, right? And that means there's going to be 2, 3, 4, 5 more years of practice that we would want to ensure is sustained for these organizations. And if not, then we're setting ourselves up to fail. And no one wants to do that. Can you speak a little bit to that?
Sure, I would say it's a both and. In the master plan, kind of altitude is really at sort of the system level of sort of that 30,000 feet. How do we help the broader state's investment have the greatest impact, be of the greatest level of efficiency, and really serve children and families in the most efficient and responsive ways. I would say the Shared Services Alliance work is at a bit of a lower altitude because it really is community-based, and it's in the community of Oakland or in Fresno or in, across the Central Valley, for example. Like, how can we come together to create a more effective business model for the early childhood sector in ways that take some of the things, as Camille said, off the shoulders of the current directors who are sort of a jack of all trades. They're running businesses, they're interacting with families, they're managing staff, they're the pedagogical leader, they're trying to get families enrolled, they're trying to collect payments, they're trying to do all of those things. And then with however the Shared Services Alliance is designed, people opt in, and then the alliance takes care of some of those things for them. So in many cases, what that looks like is the alliance will do recruitment of families, they'll do collection of fees, they can share a curriculum director across multiple sites. And so it's much more a site level type intervention that enables the program to develop and implement a more effective business model while also improving quality. And the way that these look varies widely. There's an amazing one in Seattle, for example, that really focuses on culturally responsive practice. It's a group of family child care providers that have come together as part of their own Shared Services Alliance. Someone else is taking the things off their plate that they don't want to manage, like the finances. And then they're working together to really provide in the community where they work the type of culturally responsive care that they and their families most value. And so they're doing shared professional development together. They're able to have someone come in and provide quality improvement supports that the Alliance jointly funds. And so they're able to accomplish more. They're kind of big where big matters most. And they're also small where small matters most, which is on those relationships with families. A number of them are also able, because they're able to come together, to provide health benefits for the providers in ways that each individual provider wouldn't be able to afford, but together they're able to leverage access in a way that's affordable for their participants.
Other questions or comments? again, we're looking not only for comments about these two suggestions, but other thoughts you all may have about, you know, looking, as Chris said, now into the future. This is an information item. This is an opportunity for a discussion about this. So,
Camille, I've struggled to sort of comment because I actually think the ideas are great. My inquiry in my own head is about timing and what this time of being in this current climate and coming out of it for the next 6 months to a year or longer looks like. And I'm trying to separate myself because I've been on advocacy calls for the last 3 days as I look at the devastating impact of the EC infrastructure as a result of the pandemic, the loss of revenue for childcare providers now, the ratio cuts as a result of healthier childcare settings and early learning environments, and then the proposed 10% cut on the May revise. And I am concerned about there being an EC infrastructure at all. Having lived through the 2010 early learning disaster, many of our childcare providers did not come back. We have provider testimony that's saying after they factor in all the changes, factor in their expenses, they have themselves making $1.25 an hour. And these are the people that are charged with caring for California's kids. And so I'm trying to remove myself from that in some ways to think in a balanced approach about how our first $5 can impact both short-term and long-term. But I just wanted to say, I don't have a suggestion. I think I love shared, initiating shared alliances. I agree that I think a lot of this has already started, and what kind of seed money does it need? I'm sure anything needs money to help elevate it and move it forward, but could we do both of them? Could we do all of it, right? In some way, one with less money, one with more partnership and brokering, and one with more money. I think workforce development is going to be critical as we come out of this, but I think we have to think about workforce in very different ways. And part of that is going to be attracting people to the field. Because I'm not going to be melodramatic here like my 20-year-old says, but if we don't have anybody to train, and so I'm so worried about that. And so I just wanted to be honest about the space that I'm in as I'm thinking about these, so that I could at least give my opinion, but not being able to say one way or the other how we might want to spend our money.
others? Folks, thoughts? Again, information item. This is an opportunity to, Myra?
This is more not a question, just a comment, is on the healthcare side of things, there is this really growing robust discussion around elevating a community health workforce as part of our healthcare delivery system, particularly community health workers, promotoras, and really seeing the value that they are contributing in care coordination, medication adherence, quality of care. I mean, you name it, there really is this opportunity to do more in that space. And it's a parallel discussion that California Healthcare Foundation is funding, but that many folks in the Department of Health and Human Services are engaged in, to think through how can that community workforce be integrated into our traditional delivery system of care, and how can it be paid for given some of the flexibilities under Medicaid? Part of that workforce could be home visitors. It could be family specialists. There's real opportunity to hopefully identify a long-term funding stream through Medicaid that supports these types of services. And right now we're scratching the surface with that, with health plans and reimbursement for home visiting or reimbursement for other community models. But it's definitely there. And I would encourage us, if we're not already, to reach out to California Healthcare Foundation, the Department of Health and Human Services, Department of Public Health that operates CHW programs, CDSS and home visiting, so that there is just leveraging each other's resources and discussion, so that as that conversation moves forward, we are considering the impact on early childhood development. So much of what the literature says on community health workers, it's from birth to elderly that benefit from this type of workforce, community-based doulas, you name it. But much of the attention for the community workforce is on lowering costs. So it often focuses on the elderly or people with multiple chronic conditions and not on kids. And there's a real opportunity to ensure that that workforce is also prioritized for prevention and early intervention. And I think is a good parallel to the type of work that we want to do more long-term on the early childhood workforce.
Yeah, the biggest single, you're exactly right. And the biggest single change happening in care delivery right now is much of it is transferring to electronic care delivery. So e-visits, e-connectivity, e-teamwork, e-consults, the whole electronic world is blossoming and thriving and is going to get much better. And the payers are all wrestling with how did they pay for that, and because it needs to be paid for. And the payment levels can end up being much significantly less for some things because you can do them much more efficiently electronically, and the patient satisfaction levels are way up for a lot of the electronic care compared to the direct care. So that's all going to be reinvented. And so at First Five, we should be thinking about how do we embed in that thought stream of electronic care the kinds of points and messages that we want to have going out, and then how do we want to create the kind of monitoring, screening, warning systems that we need to put in place so that the sites that need intervention for either good or bad reasons have a chance of getting there. So the whole issue of reinventing care from an electronic care perspective, there's a new national coalition that just formed to be electronic mental health care. For example, I just got an invitation yesterday to join. They're interested in figuring, because there's a lot of the coaching, counseling, that type of thing is now going to be done electronically, and that's going to stay in that space forever. But on kids, we need to figure out what's going to happen in that space for the kids. And then what do we want, back to my earlier point, what do we want to happen for kids? It's easier to figure out what we want that whole agenda to do for kids if we have a clear sense of what we want to be happening for kids, because it's easier to figure out the tool when you have the goal. So we should be thinking about that space and that tool and that goal. It's huge. The world will never, ever, ever go back to the old model of delivering care. I was just on the link with National Accountable Care Organization Association leadership. They are delighted in the ACO world that all the barriers to electronic care have been taken down, because they have wanted to do some of that for a long time, and they're getting to be very, very good at it. But they don't have any expertise on the early childhood stuff. They're doing stuff now in chronic care that is going to be much, much better for patients than the old model. Mm-hmm. So we should be talking about that. And when we get, Camila, when we get to June, we should do a deep dive into that toolkit, and both for what it's going to be, but also what we want it to be.
So I think back to the home visiting piece, Myra, so our home visiting coordination funding that you all approved, a lot of that discussion is happening in those coordination grant conversations. So we are working, and we're working with our partners at Department of Public Health and others on the home visiting piece, on the coordination piece. So some of that, your thoughts are, just want you to know, yes, we are in that space. The other is Shana has joined us. Hello, Shana. Glad to see you there. So just letting you know.
Hi, thanks for letting me in.
Welcome.
Yeah, so good. Other thoughts from commissioners, other what are you thinking about that? Molly,
Oh, she's muted.
you're
You're
muted,
muted.
Molly. You're muted.
There you go.
There you go.
I was glad to hear that these two things that you have proposed today, you want to talk about today, are in a nice dovetail with what the master plan group is doing. Because that's one thing that is important at this point with all the scarce resources and the traumatic events swirling around us with no clarity about, you know, when it's going to end or what's the landscape going to be. If there was ever a time to really focus on being very collaborative and staying very close and in very good communication so that you minimize any misunderstanding, any duplication, any gaps, this would be the time. And I just wonder if you feel, Camille, with all the staffing hits that we've taken, and, you know, also, you know, I'd love to have Chris, you know, talk about this too. They must feel in the master planning group that they're kind of, you know, trying to build while flying. They were always trying to build while flying, but now the thing that they're flying through is really, really complicated. And I'm just wondering about, as we work forward with something like these two proposals and thinking about others, how do we maximize the coordination part?
Well,
I'm happy to, Camille, go ahead and then I'll go after you.
no, I think, you know, it's building on our current partnerships plus expanding partnerships for us with other state agencies who are doing this work, maybe in partnerships that we haven't had before. Going back to the home visiting coordination grant, we've not worked as closely with Department of Public Health and others as we are currently going forward with the home visiting coordination grants. So I think a portion of that, Molly, is reaching out and creating new partnerships where they are, certainly engaging with and understanding the work of the master plan and where it's headed. It's keeping everybody in the loop, which may sound easy, but
It's not easy.
it's time consuming, you know.
Well, that's what I'm saying. I think it's very hard. It's very time consuming, and we're short folks. And Chris, did you want to, what are your thoughts?
Yeah, thanks, Molly, and thanks, Camille. I think, frankly, what we're doing right now is this. It is the beginning of what I hope is a closer partnership, and it encompasses many different departments, many different programs. We're focusing pretty heavily today on a couple of early learning and care ideas, and there are a number of pediatric ideas that are circulating. They're home visiting being kind of this kind of overarching, care and education effort. Abby's presence, you bringing on GPG, you letting us talk about these issues today, us coming back to them in June with even maybe a more robust menu of options that is more balanced between health and education. We could work on that together. That on a process level, I think that's really positive. I'm really happy about the opportunity to just keep having a conversation so that what comes to the commission is highly aligned. When we're talking about these kinds of partnerships, it's aligned with what we're looking at within the master planning process. There are going to be things that come up here that don't have anything to do with the master planning process, and that's understandable. But to your point, Molly, and to other people, Jackie, your comments about the devastating effects of coronavirus on the budget, I think there's no more important time to partner, plan, look for creative ways to solve some of these big, long-standing problems in some ways. So Camille, because First Five California can be more nimble, but then it's often one-time funding, strategizing about how to use your funds as those stimulus funds, as incentive funds, as public-private partnership funds. Like, where is it that we're heavily leveraging an investment by First Five California, by many others? That's a unique role that First Five California can play on both the health and education side. And now it's our job to kind of look at all of our options and go and vet them together as a group. And where something aligns with the plan, I will be happy to say that. And where something doesn't, but it still has a huge amount of merit, that's also worth our consideration. So if I see people nodding, I mean, this is an informational item because we have a big financial, retreat coming up, and it's sort of like teeing up a couple of ideas, but there could be so many more. And we could even bring the master planning team in for one special ad hoc session, Camille, if it's helpful, where they can, not me, they can present to the commission and give them the bigger picture and answer questions about the plan as background on bigger conversations later on. We have materials to share that are written, but I know how bogged down everybody is, so I kind of hesitate to do that. So I offered them up. Janelle Kubanek and the West Ed team are the leaders on the plan, but they have a big, wide-ranging group of experts such as Abby Thorman and Louise Stoney, and
That'd be wonderful, Chris. That'd be a really great thing.
It might be great. Yeah, I mean, I think they're available.
Yeah,
It'd be great.
wonderful.
But then let me just go back to Camille. Camille, I mean, what can we do to help you?
Well,
Good question.
so, we're working hard to bring on additional staff to replace some of those who have left or are leaving. So, the state hiring process is not always a quick one, but we're working to fill some spots, get some more people on board. We're leaning heavily on our partners like Abby Thorman and others who have reached out to us and are helping us think these things through. What can you do? So I think for us, it's really giving us clear direction on what you want to see us come back to, come back to us with, allowing us to take that and work it and come back. So it really is helpful when we can go forward and know what it is you all are thinking about wanting us to pursue, and so that the work we do is targeted and gets you all the information you need to make the best decisions you can, and helps us go forward, and just your understanding, which you have, that right now it's the bench is getting a little thinner for the moment, but it's recruiting season. So we're out there, looking to build it back up a little bit. So not a whole lot, because right now it's tough. I mean, the state is in a place where building a big team is not what, with everybody's budget and looking at it, it's not easy. So, Myra.
So just two quick thoughts. George, to your point about that we're never going back to the same style or delivery of care system, I couldn't agree more. This is completely different. However, I would caution us to really consider who it is that continues to be left behind because of the transition to technology.
Yes.
In the survey that we sent, it was 1 in 3 families that were skipping health visits for their kids. Over 90% of families want to do telehealth. Less than 20% think they have the capacity to do it. So I think we don't want to exacerbate the health inequities that we know exist.
And
And
some of the community clinics say that the real low-income families getting telehealth have no privacy. And so there's some real barriers on both the coaching and counseling
absolutely.
and the other issues. So the privacy issue is huge.
Mm-hmm. So just thinking that have it in our heads as we move forward, how we can tackle those inequities. And then the second thing, in the spirit of information sharing, your point about accountable communities for health. California made a huge investment a few years ago in accountable communities for health, of which one was specifically focused on children, young children. All Children Thrive. It has a shared services alliance model. They've been doing research and evaluation for a few years. So it's these like siloed conversations that we often find ourselves in, and how can we work to break down those silos so that we're leveraging resources where it's possible. So I would strongly either have a learning opportunity for all of us to learn more about All Children Thrive and where it's run out of the UCLA Center for Healthy Children, Families, and Communities. But there's sites all over the country. And we would love to explore more how we don't reinvent the wheel, but really take valuable learnings from investments that have been made to hopefully change the way our system delivers care in the future for vulnerable kids and families.
It's a great idea. Yes.
Others? Chris?
Process, yeah, Camille, who's on the program committee?
Currently, it's Molly and Jackie.
Okay, and it seems like in anticipation of any future meeting, and that you're building up your team again, and so maybe the program committee and some of your consultants and some of us, on different teams, the administration team, et cetera, could work with the program committee in anticipation of your June retreat to get a bigger, more, fleshed out set of options going. I mean, I'm just trying to think of creative ways for a few months to feed information in. You've got GPG coming on, you have others. That maybe we could just all kind of lean into program committee for a couple months, just to, make master planning team could present to them. I'm just offering all those things to when you're thinking about how to do all this. Maybe we can use the subcommittee structure more in between the commission meetings so things come in more, fleshed out.
Okay. Molly? There you are.
Well, I think that that's a good idea and would work best with maximum participation in the program committee by as many of the commissioners as would want to attend the sessions. To me, it's a good thing to talk about today, actually, which is what is the appetite of the commission in preparation for the June meeting, which is now pretty close. What's the date of the June meeting? I'm sorry. Oh, we don't have it because we're trying to, it's the 15th, it's 17th, 22nd.
15th, 17th, or 22nd.
Yeah. Okay. Well, first of all, do we agree that if we could learn more about the options and the master plan thinking before that, we would be better able to come out of that meeting with some good, crisp, actionable thinking. And if we thought that would be helpful, what's the appetite of the group for having a program committee meeting with sort of as an open to all commissioners kind of thing, and let the presentation that Chris is talking about occur there.
I think we could do that.
It's a push. It's a push thing. It really has to do with everyone's appetite for a hard push right now.
I think we could legally do that because if we invoke the rules for crisis and then do full notification through all the right processes, we can invite everyone who wants to sit in on that group. to be a participant in that discussion.
Yes, what we would do is put together another emergency if it went beyond the 2 advisory committee members, which is fine, we could do something. In fact, when you all were talking about it, I was thinking, okay, is there an appetite on the commission to say, okay, we're gonna agendize an emergency meeting. The only thing on the agenda would be a presentation let's say, the master plan by Janelle and folks, and it would kind of be, an information sharing, brown bag lunch. Let's spend an hour and a half listening, getting information that could, really help in the
I think that would be a wonderful meeting, but I think we might not be able to do it because the reason we can do the broader meeting with the other committee is because we had each of those people named to that committee officially at the annual naming of the committee meeting. And we didn't do that for this. And we can't do that today in this meeting because that would be a violation of the topics that we're authorized to discuss at this meeting. So I think we would almost have to have a special meeting just to name the committee, unfortunately, because I think it'd be a great idea, but I don't think we can do it.
I think if we invited the whole commission, George, and said.
We could do the whole commission.
Yeah.
Yeah.
We could do the whole commission. We could make it a meeting of the entire commission.
Sure,
Yeah.
and whoever could be there. That's an option,
We could even do like a first 5 network
Be a whole commission meeting though,
meeting.
and not a committee meeting.
Yes.
Yeah, maybe it's also, I want to make sure our friends at the association and, the network you're a part of, Camille, maybe that would, in a way, give us all a chance to have this conversation about the master plan. And it's a critical juncture that,
Sure.
they have leadership coming in, but they also have staff and they have a board and,
Yep.
maybe that would even kind of open up this, conversation about the whole network.
Sure. Absolutely. Do other people have
We
their?
could have a meeting of the entire commission. The other thing we could do there is have a meeting of the entire commission and to keep it under the program committee banner. Molly is our vice chair. So I could show up a couple minutes late to that meeting and she as vice chair could convene the full commission and then I would just listen from that point on. And that would be, then it would be functionally a meeting of that committee. So I think we could work that out as a way of getting
we
it
could
done.
work out the details. Yeah, we could put it together.
Yeah,
Just knowing if it's something you all are interested in, happy to invite our county partners and the association, and it is a presentation that we all learn, from and have an opportunity to ask some questions. And Shayna's got her hand up. Yes, Shayna.
I'm wondering, so I think it's a great idea to bring all the folks together that have been described using the process we talked about. I'm wondering in terms of other folks, and I've been thinking a lot, so since Chris shared about leverage and obviously leveraging everything that's happening with the master plan, with government funding, but I am sort of wearing my philanthropy hat and wondering, are there major private funders that need to be part of this conversation? And then what does that look like? And I can't think of any time actually, while I've been on the commission, where we have really engaged them formally as a commission. I know that happens behind the scenes and with staff, but I think as we're thinking about the significant challenges the sector is facing and the appetite of private philanthropy to really invest, I think we need to have that voice and that perspective as well.
Yeah. So we've been working on public-private partnerships now for a couple of months with the master plan. So your perfect question, Shayna, we can report out on those meetings, what has risen to the top of the list in those meetings. It's very similar to what we were starting to share today, but it can be more detailed. And it's more than just this shared services idea. But this is actually because I see First Five as, as this kind of incredible, like, public sector philanthropy in a way. It is the perfect spot, for First Five California to land, is to bridge the public and private sectors, the philanthropy and public sectors. That would be great. So we can report out on that, and we can even, as we move forward, there may be an opportunity to put some of you in some of those meetings. Right now, Kim Belche, for example, has facilitated a few sessions.
And I appreciate that. And I am thinking of crazy ideas, because why not? This is a crazy time. And as we think about, private funding, there's, my mind obviously goes to, big pots of money, but I also think along the line of crazy ideas, there are things we could do with, an online fundraising campaign. And I know just sort of like what we've seen locally is, organizations have really raised the flag around child poverty, that people want to support that, right? And we have this amazing platform through First Five, whether it's social media or other PR efforts, in raising small dollars that could turn into really impactful big dollars as well. So I think just thinking broadly about the role of private funding in supporting the work we're doing.
So Shayna, can I just ask you, when you were thinking of philanthropy and the master plan conversation, were you thinking of including them to inviting them to say, the master plan folks are going to present to us? Would you be interested in, or because Chris and I would look to you, you all are working with them, would that, they already know.
Would that help you or hurt you in the process?
Yeah.
Would be an asset or not?
Not knowing which specific funders we're talking about, I don't know that I can answer. I think if it is helpful to include them, and the experiences it is in the conversation as appropriate, and I again defer to Chris because I think she's working much more closely. Absolutely.
Chris?
We are now asking for 3 meeting dates. We could probably use 2 of the 3. We've already got a survey going on. Rather than try to find a 4th date, we're already asking about 3 dates. Maybe the best thing would be to have one of the first 2 be the commission, and then the third be, or the special meeting, and then the third be the actual budget meeting. So have we had any response yet to those dates?
Well, the first set of dates we put out, it didn't work for folks. So again, I just told you at the beginning of the meeting, the second set of dates, and we're going to hopefully send something out today for you to check the box. Okay.
So the question we might use, I guess what I'm saying is use 2 of the 3 if that works for the number of commissioners that can be there.
Right. And clearly we need to check in with Janelle and folks to see when their availability is as well. So Chris, back to the philanthropy, and then Jackie, I know your hand is raised. You'll let us know if, what is best in that regard. Yes?
Yes. I'm going to, no matter what, we'll report out on it.
Yeah.
When there's a master plan presentation, we will include an update on that.
Got it.
In terms of getting more in the weeds, like, would you want to show up as that kind of partner as well? So right now, honestly, these options that were presented today were as a public partner.
Right. And
the other way of looking at it, and you can do both, is thinking of you as a philanthropic partner. Because you're kind of both. Let's do the master plan so we're talking about both. when we do that overview. And then I think then this commission can sort of feel where it resonates more, what's more, you know, that'll be a chance for everybody to react.
Okay, Jackie, thank you.
And I think all the meetings are great, right? We have a lot to talk about. We have a lot that we want to do. And I love the idea of philanthropy being woven into this. My question again is always about timing. And do we need to vet our ideas and our desires as it relates to connecting with the master plan, looking at these ideas that have already been presented to us, and fleshing that out a little bit before we bring philanthropic partners on? Or were you all suggesting that you wanted them as part of this vetting and idea process?
Well, it sounded to me as if Chris was sort of heading toward not inviting the, you know, kind of usual suspects in the world of philanthropy that work in early childhood. Not making, of course, it's an open meeting and it'll be noticed and maybe people will come. I mean, but I think what she sort of, Jackie, I think, intuiting what you're suggesting, which is the logical thing is to have a little bit more process among the commission before, you know, trying to add them intentionally to the mix. I think that's right, but I was kind of reading a few tea leaves there, Chris, is that right?
Sorry, I don't know why my camera, I feel like I'm on a weird, can you feel it? Like a delay? Yeah, it's really, really weird. I feel like if I took myself off camera, let me just try that, and my voice might work better. Is this helping? I don't know. It is. So Molly, what I'm trying to do is, and I'm only in this one vertical right now called the master plan. There's clearly a lot of other work going on with the commission and everybody else. But as the master plan goes, there is the public-private partnership conversation isn't that different from the one we're having today. They were interested in very similar issues. They were kind of already going in those directions before COVID, and even before we started master planning. And I think those are important organic moments. So when you see philanthropy and community organizations kind of gravitating to a few ideas, that's when the master plan can kind of talk about how to scale them. And that's what we would talk more to you about in a presentation in the future. And you would then also hear about how, you know, a few dozen philanthropies have been approached and are showing interest as well as a way to, you know, not only validate, but put you in that group too. Like you wouldn't, we often function in a little bit in our own stovepipe here, right? And so getting to be in that group on something would be different and positive. I also want to acknowledge for particularly Myra, but others who have flagged that the whole child, whole family health recommendations from the plan, those are not as developed yet as the early education and care recommendations, but we're going to double down on them very, very soon. And we'll have more to present on that as well in the future.
Right. Good. Okay, so far, just to recap, oh, Shayna, first of all, hello.
Yes, we have
next to you.
This is Sloan.
Sloan, you have amazing hair. That is just my favorite.
Yeah, we have another one with the same hair as well.
Really? Wow.
Yes. So I guess one of the other things I'm thinking about is as I look at, you know, the requests that were included or the potential requests that were included in the agenda item, the $1 million and then 1.5 million. Does that reflect what would be required to really meet the need in terms of these two areas? And for me, it then connects back to the private philanthropy question, which is if the actual amount is larger, I think it would be helpful for us to think about that, right? So if it's really say $3 million for these alliance grants, I mean, I'm just throwing out a made up number. It would be helpful to know that and then to think about how we can bring in other partners to make up that gap instead of saying, well, we think we only have $1.5 million, and so that's what we're talking about, instead of sort of thinking about what is the real cost. So just want to throw that out there as we're thinking about sort of the larger funding ecosystem.
Okay. Abby, do you have any, or Aaron, any reaction to that? Or I think we were trying to kind of put some, just to give you some idea of what, you know, we were thinking about, and kind of put some price around it. So, but as far as larger, I don't know, Abby, in your work, you know, what you've seen, do you want to respond to that?
Yeah, I think that we played with some general numbers, sort of back of the envelope numbers, but if this is an area that the commission wants to pursue, can certainly build out more detail about both what other investments already exist in each of these areas, and then what the delta would be between this and, you know, kind of getting all the way to the promised land and having it fully built out, as well as some potential other areas of investment that may come in to help complement First Five's investment. We really saw these two levels as being something that would really be catalytic in terms of leveraging broader impact, as well as spur other potential investment and make a big difference for providers directly. So kind of hitting that sweet spot of all of those things, but can build out a more detailed budget as part of the follow-up.
Yeah.
Again, looking for direction from the commission today to say, yes, you should go back and build out that proposal. That's a good one. We'd like to know more about that and consider that. You know, or maybe the answer is we want to wait until after the June budget retreat and then, you know, kind of say in that.
Now, let me call the question on those two. Would anyone like to move forward on either of these first two ideas, lovely ideas, or should we hold off until the retreat before going forward? Or should we pick one or both and go down this path? What would you like to do?
I really like both of the ideas. And if I thought that waiting a month or less than a month to have the budget retreat and the fuller discussion about the master plan would in some way impair our participation, then I would say, sure, let's build them out right away because they're great. But if it's not going to impair anything to wait 1 month or less, really, I think I'd like to nest them inside the larger conversation. I think you know, just there isn't any reason to ask the staff to work hard on them right now. Maybe a better use of staff time is to, you know, do something else right now, and that would, Camille, you would know that, but you know, staff has got to be stretched thin, and you know, I just think that we should be careful of staff time, and you know, should we really ask them to take on a bunch of work to do something that could be upended by a meeting we're going to have that's going to talk about budgets and other, you know, I don't know, I just feel like maybe better to just wait if it's not going to impair our participation, and that's my question.
Okay, that makes sense. What do other people think? Does that make sense?
I don't think the delta between where we are now and where a more built out set of recommendations for you is very large, just given the conversations we had in preparation for this meeting. So not to volunteer staff time, I'd be volunteering my time to work with the staff, but I think that we could easily bring a more robust set of details and kind of the next few layers of information, as well as some of the questions like that you asked, Shana, that could help you evolve the consideration. I don't think that it would preclude your involvement long-term, but you know, as we know, there's a lot of things that are moving very quickly right now, and there are a lot of needs where this could help, that could help, these investments could help address, certainly in communities and for the workforce.
And this is Chris, I would just echo that. I think, you know, given that Abby's sort of in both worlds and sees what is in the pipeline and knows what she can produce for all of us, certainly for June. you know, I think if, I really hear what Molly's saying, and I agree with her 100% that we don't have to go faster than June, but we can do quite a bit in June, if that makes sense.
Yeah.
So what we could do is bring back as part of that budget discussion, more details around these two items that would help, you know, everyone's thinking about what that looks like and what that more detailed process would be.
Mm-hmm.
Does that
Does
work?
anybody want to move to do it right now? Or should we wait? It sounds like a consensus is around fleshing it out, talking about it again in June.
Okay.
Okay, good. Well, if we have resolved that by, as I understand the rules, we are not allowed at this stage to go forward and introduce new topics or new agendas, or to do any other work relating to other old topics or old agendas. So Camille, is there any other kind of thing that you want to talk to us about or share with us that would make sense in this, in the context of this discussion?
Just to say, so what we heard from you, and we will certainly work with Chris and the master, with Janelle and others, that what we're looking for is a presentation, an information presentation on the master plan and the work they're doing before the budget planning session. So, and that certainly will be putting that together. GPG will be, just to remind you, will be reaching out to talk to you about the budget workshop to make sure that individually you're having an opportunity to talk about what you'd like to see, what would be helpful, what those kinds of opportunities as well. And you'll receive today, yes. You'll receive from us today a doodle poll about those 3 dates, 15th, 17th, or 22nd. We're hoping that we can land on one. We thought for the budget retreat, it was really important that we get all of you there. You know, so we'll look to that, to do that. And the other thing is just for all of you to say congratulations to Molly. She's a new grandmother. She has a beautiful new grandson over this last week. Yay.
Yay. We're COVID babies.
Yeah.
I know, isn't that crazy? It's crazy. That's a bright spot in such an awful time.
Yeah.
He's doing great. His name is George.
Good name.
Is that great, George?
That's a lovely name. I like one of my favorite names. It's all good. Thank you.
With
Well,
that,
let me, one quick comment, Chris. Thanks for bringing the plan to that meeting. That is a wonderful thing to do, and it'll give us a great sense of context and a great sense of who those folks are doing that work. So much appreciated. Thank you.
George, do you want to just ask? We don't see anybody's hand raised for public comment.
Oh, yes, I do. Is there any public comment? Anyone in the public like to comment at this point on any topic?
Nobody. We don't see anybody.
If
We
there
don't.
is- if
We
there
don't
is
see
none,
anyone.
there is none. We all need to move on. Now, everybody be safe. Stay away from any risk that you can possibly stay away from. And I am working a lot with a couple of COVID coalitions, and this is really not close to over. And we've got some really tough times ahead, challenging times. And the unraveling, we're gonna have to go through an unraveling. The very youngest people are extremely low risk. The very oldest people are extremely high risk. And so we're probably gonna end up decanting, after we get through some of the politics, decanting by age in some way, but the likelihood of decanting quickly is not very high because we don't have a vaccine or a cure right now in the process. So this is not gonna go away for a long time. We're gonna be wrestling with it for well into next year and probably beyond that. So not at all good. And I would say really quickly, Gavin Newsom has been a superstar. He has been absolutely spectacular. The whole country is admiring how well he has done, and the mayor of San Francisco have done in cutting the death rate for California way, way, way below what it would have been had they not had their wisdom and their insight, and then had they not had the ability to move forward in the ways that they have moved forward. So we are very fortunate to have that happen. And Chris, if you want to pass that back, that would be a really lovely thing.
I will. And I know he would appreciate hearing that from you too. So I think that's a great positive note to end on.
Great. So without anything else,
Did someone move that we adjourn?
yeah. Anybody want
Somebody move to
to?
adjourn, please.
I move.
Move. Is there a second?
Second.
Jackie seconded.
All right. All in favor, say aye.
Aye.
Opposed?
Aye.
We are adjourned. Thank you very much.
Thank you, everyone. Have a good weekend.
Okay. You
Yeah.
too.